Hi, I'm Dr. Terry Wood, and I'm here at my clinic, Mustang Veterinary Hospital, Mustang, Oklahoma. And today's topic is I'd like to visit with you about prescription drugs. As a little bit of background, I am a integrative veterinarian. I'm classically trained in Western veterinary medicine. That's what I was trained in. That's what I did for a number of years. And then for the last 30 years, I've integrated quite a bit of holistic medical practices into my practice, because our goal is to do the best for your pet, and whatever that takes, that's what we want to try to do. As an example, in traditional veterinary practice, if a pet has an infection and they need some antibiotics, which unfortunately happens all the time, we'll be happy to give them the antibiotics. But what I found out, and before I was really realized what was going on, we kill a lot of good bacteria when we give the antibiotics, and that's not a really good thing, because we need that, and our pets need that healthy bacteria in order to get well. And so what I do on every case that's come in for probably the last 25, 30 years is I always give a dose of probiotics, or we send it home for the full course of the antibiotic treatment. And it's just super important, because the antibiotics, our goal is to kill the evil bacteria, but unfortunately we kill a lot of the good bacteria that help keep the pet's bodies functioning and working as they were designed to do. So it's extremely important to do that. Another area that I see a lot of is that in my practice I use an extremely limited numbers of NSAIDs. In fact, I have one older dog that I use them as a end-of-life care, just to try to keep the pet comfortable, full well knowing that the side effects are potentially fatal in themselves. A lot of practices hand the NSAIDs out like candy. I prefer not to do that. It's really, really, really essential that in the process of helping your pet's pain that we don't kill them in the process. And that seems a little simplistic, but I see it all the time. Why is my pet bleeding? Why is he having nosebleeds? Why has he got a stomach ulcer? Why is my pet dying? Well, it's because of the NSAID he was on, and we need to try to fix that. I have talked at various places, and I had a veterinarian from out of state who had heard me speak one time, and he contacted me and he said, my surgeries, he said, I've heard you talk, and he said, your surgery's at 10 days, the incision looks like it's been done, the surgery was done 3 weeks ago, and it's only 10 days. He said, mine, I have to leave the sutures in sometimes 2 or 3 weeks, or it comes apart. It de-isses if I take him out too early. And I said, well, are you using an NSAID as well as a narcotic as a post-op pain relief? And he said, yeah, I'm using both of those. And I said, well, if you had just had surgery, would you knowingly take a drug that inhibits healing and causes your blood not to clot? And he said, well, no, that'd be kind of silly. And I said, well, what is the NSAID doing? He said, oh my. So anyway, I had a convert. He changed his ways. I called him a month later and said, hey, how are your surgeries looking? He said, they're looking great. 10 days later, looks like it's 3 weeks. Thanks. Really has been a big help.